COVID-19. We discuss in this episode of The Chiefs. And welcome to this extended ECQ edition of The Chiefs. With us, of course, tonight online, just like everybody else, are Ana Marie Paminton of the Philippine Star, Luchi Cruz Valdez, the head of News 5, and Robbie Alampay of One News. Ladies and Robbie,
Happy extended
Monday.
ECQ.
Happy Easter kayo naman.
Happy Easter pa rin. Happy Easter pa rin.
Happy Easter naman.
Okay.
Wala ba kayong ayuda makukuha?
Hindi, at least medyo gumanda-ganda yung numbers ngayong araw, di ba? Hindi lagpas ng 9,000.
Yeah, but remember what remember what Guido said, expect artificial dips in the next few days.
They did tell us that. Yeah, I remember. And it happened.
Yeah.
Yes,
And kasi
Wednesday, tapos bumawi nung the day after, tapos medyo bumalanse nung nag-12, tapos
Nakakatakot kung ano talaga yung mga ano sa hospital, ano?
Hindi, tsaka on the other side of it, people also have to be brave. So on the one hand, we're qualifying the relatively low numbers now. But on the other side of it, you brace yourselves also na baka biglang tumaas because they're now going to start counting
hahabol ang numbers.
Well.
Yes.
Diba? So hindi lang hahabol, baka pumalo beyond what our usual baseline.
Oo nga, nako.
Imagine 40 test centers ang nagsara during the holiday. So, can you imagine, di ba? Hahabol
Lalo nagpanik na mga tao.
Yeah.
So expect irregularities in quotes in the numbers for the next few days. Medyo it'll be a little bit difficult, I suppose, to set a trend or to predict a trend. Based on the
Sabi
next
niya,
few days.
1 million daw, di ba? By April, end of April, although mabagal na nga. Mabagal
Yes,
Yeah.
pero ang problema ngayon talaga is really active cases and what that means for the hospitals. Kanina kausap ko sa Big Story si Dr. Almora ng Philippine Hospitals Association. Alam mo, tinanong ko, kumusta po ba at ground level? I mean, what can you say? Sabi niya, it's a nightmare. Walang patumpik-tumpik. Sabi niya, it's a nightmare. This is the worst thing that we were afraid of and now it's happening.
Well,
Yan na segue.
Okay, nauna si Ami mag-segue.
Sige, game na.
Okay, let's bring in our first guest for tonight, Dr. Maricar Limpin, the Vice President of the Philippine College of Physicians. She is also with the Lung Center of the Philippines, one of the COVID referral hospitals. Dr. Limpin, ma'am, thank you again for joining us and welcome back to the Chiefs.
Good evening, Doc.
Good evening, Dr. Limpin.
Yes,
Opo.
pero hindi ako lang center heart center ako.
Ay, sorry, heart center pala. Heart center pala.
Ibang organ.
Magkalapit na rin, magkalapit na.
Wrong organ. I apologize for that. Magkatapat naman yung dalawa eh. Well, ma'am, the health department was talking a while ago, earlier today, about imposing a new triage system, wherein effectively the DOH and the LGUs will be intercepting. Well, I don't know if that's the right word, but they'll be breaking what used to be the procedure. People going directly to the hospitals. Instead, they will be intercepted. You might put that in quotes by frontliners who will determine where they should be going. Para to, I suppose, to decongest the hospitals. My question to you po is this: will that work? And secondly, should we have imposed that earlier, or tama lang na ngayon lang gawin yan?
Actually, dapat palagay ko, we should have done it earlier kung yun ang plano, kasi importante na hindi talaga ma-burden ng husto yung mga hospitals like what we are experiencing right now. So, tama si Dr. Almora, yung sinasabi nga ninyo, na talagang what we are experiencing right now is like a nightmare for all of us. Lalo na kami mga healthcare workers na tumitingin doon sa mga pasyente.
Like Dr. Limpin, I hope you don't mind because kanina nung in-interview ko si Dr. Almora, sinabi niya it's a real nightmare. And I asked him to expound And I honestly feel he ran out of words because nung tinanong ko, pwede po bang pakidetalye, what do you mean by a nightmare? Sinabi niya, it's just a nightmare. And he really did not expound on it. Can you expound for us what you're seeing on the ground in the hospitals? What do we mean when we say it's a nightmare?
Definitely, no, kasi yung lahat ng hospital beds, punong-puno na kaming lahat. And even in the emergency room, ito yung aming ayaw namin mangyaring makita, no, for the past many months, pero nakikita na namin ngayon na maraming mga pasyente ang dumadating doon sa emergency room. Mahaba ang pila. Sa ibang mga private hospitals, mahaba ang pila. Like, let us say, ang pasyente dadating number 45 pa sila. At walang guarantee na matitignan kaagad sila. Kasi syempre, first come, first serve basis yung kanilang Or maybe by prioritization, mauuna kung sino yung mas tingin din, mas nangangailangan ng immediate attention. So, marami dito na maiisip namin, ito, yung pasyente mas nangangailangan, pero hindi pa namin nakikita yung iba na maaaring mas nangangailangan pa. And that is the reason why marami yung mga maririnig natin na dahil natatagalan silang makita sa isang ospital, lilipat sa ibang ospital at pagdating na doon sa ibang ospital, no, namamatay sila doon because they have not been attended. And yun yung maraming nakikita kami ngayon, no? And sa emergency room, even doon sa amin sa hospital, sa heart center, no, we are not a COVID hospital. And yet, ang daming COVID cases doon sa emergency room. Maraming nangangailangan ng procedure. Yung iba wala ng beds. So, yung iba, ginagawa namin ng paraan kahit nakaupo na lang, no? So, you can just imagine, nga yung mga pasyente and yet they cannot really parang makapag-rest yung katawan nila kasi nakaupo lang.
So, Doc, can you give us an idea of the average waiting time for a patient in the tent or outside of the ER? Nakakaabot ba yan ng 1-2 days, maybe even 3 before they're finally admitted?
I'll tell you yung na-experience namin, ako, kunyari, na-experience ko sa heart center. Sometimes it takes really days. Not just 3 days, 4 days, 5 days, bago pa sila ma-admit.
Wow!
Yes. So, in the other hospital na affiliated ako doon sa Tondo, Manila, ganun din. It takes them 3 days, 4 days before they are admitted. Kaya talagang yung ibang pasyente pag wala kaming kwarto, wala na kaming bed na maibibigay, sinasabihan talaga namin, kung gusto ho ninyo, pwede ho kayong maghanap ng ibang ospital. No? Kasi talagang medyo hihirapan kami mag-admit.
Pero so while they're waiting, anong ginagawa ninyo? I mean, what kind of treatment do they get, if any? Meron ba?
Meron. Kasi hindi namin pwedeng pabayaan ng mga pasyente basta nandoon na sa ospital. So lahat na kailangan na treatment na kailangan ma-receive nila, binibigay na namin. Yung ibang mga pasyente intubated, like in the emergency room, marami kaming naka-intubate. May 2 kami, may naka-high flow. Lahat
ER pa lang, ha?
Doctor, hindi ba sabi nila, mas mga 90% ng COVID cases, mild or asymptomatic lang eh. You think yung sinasabi nila ngayon na dapat mag-triage na nga, tapos para daw mag-move out na yung mga you think it's a viable solution na nga para magkaroon ng lugar sa mga ospital? Kasi hindi ba marami naman dyan na pwede na daw ilipat sa isolation center sa mga hotel, sa mga schools. You think this will actually ease the nightmare or it's too late?
Yung nakikita na kasi namin sa mga hospital ngayon, hindi siya yung mga mild lang eh. So, hindi talaga sila yung mga pasyenteng pwede nating pwede nating i-refer sa isolation facilities, no? So, ito yung mga pasyenteng mangangailangan talaga ng admission sa isang ospital at marami sa kanila mangangailangan ng oxygen. Remember, no? Meron tayong mga 10,000 cases, 15,000 cases, meron pa noon. Pero sabihin mo ng 1% of that, no? Pagpalagay mo na 1% only mangangailangan ng intubation. So ilan na yung 1% na yon, no? Malaki na yon. So talagang nakakakita kami, and for heart center, talagang lahat ng nakikita namin na nasa emergency room nangangailangan talaga ng management and care. Talagang kailangan admitin sa ospital. So these are not just the run of the mill. Meron yung mga moderate, no, yung moderate na hindi naman nangangailangan masyado ng mataas na oxygen requirement. So ito yung mga pasyenteng dapat pa ring admitin, no, kasi ito yung mga tipo ng pasyente na after 1 week maaaring mag-progress ang kanilang mga COVID-19 disease, no? So from moderate pwede silang maging severe. Kaya ina-admit na rin namin ito because we know na pwedeng maging pangit immediately yung kanilang and true enough, that is actually what we are seeing. In just a matter of few days, no, minsan yung isang pasyente hindi nangangailangan ng oxygen, biglang nangailangan, and then eventually na-intubate. So meron ganyang mga kaso, no? So hindi ka po pwedeng sa COVID-19 maging kampante na sabihin mo, ito hindi nangangailangan ng mechanical ventilation because you do not know kung ano ang pwedeng mangyari sa pasyente. In fact, sometimes it's now difficult kasi we are seeing 27, like ngayon, meron kaming 27-year-old male patient, walang comorbidity, no? And yet, naka-mechanical ventilation, and even we are also already providing extracorporeal membrane oxygenation para lang ma-improve yung oxygenation ng pasyente. So, hindi na siya yung the usual na nakikita namin noon. Actually, masyadong nagbago ng husto yung manifestations ng mga pasyente.
Doc, are you saying that the virus has become more deadly, or it is causing more severe symptoms of the disease compared to last year?
No, I think
are you...
no. I think because of the number of cases that we have right now every day, therefore it will follow na maraming pasyente ang dadami din yung pasyenteng makikita namin na mas pangit, no? Kasi dati mga 1,000, kunyari 2,000 cases lang, ilan lang ang makikita namin na mangangailangan ng mechanical ventilation. Pero ngayon, we are seeing 10,000. Talagang burden ang lahat ng hospitals.
Doc, can you give us some basic guidelines para lang alam namin pagka may sakit, pagka mayroong nag-positive sa amin, and I'm inevitably we're all asking for people that we know. But kung nag-positive, for example, pero asymptomatic, when do we know if we should go to the barangay, go to an isolation center, or try our luck at the hospital? What are the different levels of alarms or red flags can we take as our own signposts on where to go or to stay at home?
Yes, unang-una, no, kapag meron ho kayong, kunyari, nilagnat kayo ng konti o kaya parang ang feeling ninyo, meron kayong parang flu-like symptoms, kailangan magpunta na ho tayo doon sa community health facilities natin. Not immediately to the hospital. Kasi yun sa community health facilities natin, sila na yung magdi-determine kung kailangan ninyo ng hospital care. So mas madalas yan, papa-x-ray nila tayo, magpapa-chest x-ray sila. So pag sa chest x-ray normal naman, then most likely mild lang yung yung COVID-19, and then therefore pwedeng nasa community isolation facility lang yung pasyente. Pero kung kahit mild pero may edad, no, yung mga elderlies natin or may mga comorbidities, kailangan makita yan sa ospital kasi yan yung mga tipo ng pasyente na maaaring mag-expect tayo na mag-progress, no, yung kanilang mga sakit.
Ngayon yung medyo mga matatagal na sa hospital, halimbawa naka 1 week or mga 10 days na at mukhang recovering na, okay lang sila na ilipat na daw sa isolation. Ililipat sa ibang lugar, tatanggalin na dun sa hospital main area para daw makapasok. Okay lang yon.
As long as meron hong facility na makakapag-isolate ho sila, pinapayagan ho namin lumabas, ano? Pero sometimes kasi yung mga pasyente kahit naka 10 araw na, no, doon sa hospital, minsan po ay nangangailangan pa rin sila ng close monitoring ng management kasi marami pa po kaming nakikitang mga abnormalities doon sa baga at naka-oxygen pa ho sila. So, hindi ho talaga ganun kadali na mag-discharge ng mga pasyente, no, na with COVID-19. Mas madalas ho, they have to really stay in the hospital for 2 weeks. In fact, kung severe at yung mga critical na COVID-19, mahina ho ang 3 linggo o 4 na linggo sa kanila.
Oh dear.
Doc,
Pero ang dami-dami
we'd like
naka-home
to...
isolate. Ang dami-dami naka-home isolate eh. Sino-sino yung mga, okay lang ba yon? Marami mga asymptomatic sa mild na nag-home isolate na lang eh.
Yes,
Siyempre, you need a big enough house, ano, siyempre.
yeah,
Okay lang.
yung mga wala namang positive lang pero asymptomatic, they can just go on home isolation, no? But kailangan talagang home isolation yan. Ibig sabihin, siya lang yung nasa kwarto at meron siyang sarili niyang toilet and bath na hindi na siya lalabas pa at makakahawa doon sa mga kasamahan niya sa bahay.
Doc, we're trying to reconcile po the numbers coming from DOH, yung data ng DOH, with the reports that we're getting on the ground. Like for example, today ang sabi ni Yusek Berhere, by their own survey, mga 40+%, 41% na mga nasa hospital are mild or asymptomatic and therefore they would have to be moved to isolation facilities. So yun po, 4 out of every 10 yun. Tapos yung sa today's graphic naman from the DOH, it says na in NCR, 79% po yung utilization ng ICU bed. So meron pang 21%. And so on down the line, 72% utilization sa isolation beds and 60% sa ward beds. So although critical na yung iba, pero meron pang available daw. We're trying to reconcile po ano talaga,
Yes.
may available ba o talagang punuan na o hindi lang namamanage ng maigi yung distribution?
Syempre, I can only speak for the hospitals that I am affiliated with.
Opo.
Definitely, kunyari sa heart center, ang ICU namin for COVID, puno na po. Yung non-ICU, yung sabihin natin na COVID ward, nag-open na ho kami ng pangalawa. No? So, meron pa ho kaming inopen na isa pa na ito po yung talagang close monitoring, hindi lang pala pangalawa. Napakadami na ng ano namin, pero hindi na kami makapag-open pa ng mag-open kahit gusto namin kasi napakakonti nung kakulangan natin doon sa healthcare personnel, ano, no? Lalo na yung mga nurses kasi marami na rin sa mga healthcare workers ang positive and therefore kailangan din nilang quarantine. So doon sa isang hospital ko, puno rin po. Lahat ng mga hospital ngayon, no, Chinese General Hospital, puno. Emergency room, ICU, mapa-ward man, lahat ho, NKTI, lung center, 100% ang capacity nila. So talagang wala.
Pero
hindi
bakit po ganoon ang figures ng DOH?
Kanina nga sa frontline, yung San Lazaro, 3 na sila sa ICU bed. Ganun na kalala. I mean, 3 na sila sa isang ICU, ano bang tawag doon? Unit.
Yung ICU room.
Yes. Ganun na kalala, Doc. I mean, and yet, when you look at the figures nga, I agree with Ed, no? When you look at the figures of the DOH, parang, okay pa naman na, 60%.
May 21% pa, may 28%, may 40%.
We're trying to figure out.
No, I think kasi ang figures na binibigay sa atin ng Department of Health, I do believe, no, it's a national figure. So of
Di ba,
course,
ito, may NCR, may national po. We're citing the
NCR,
NCR figures
yes.
po. It's in the daily
NCR,
graphic of DOH eh.
yes.
Specifically, NCR po ito.
Oo nga, hindi rin namin maintindihan.
Hindi ba realistic yan? Hindi ba realistic yung
Definitely, ano
figure
po?
na yan?
Anyway,
Hindi,
Doc, what's mali, ang malinaw, Doc, is what you're describing, and yung dinidescribe ni Dr. Almora, hindi tugma doon sa the picture being painted by the official numbers. Now, we're all dreading a certain word, no? And that is the word of collapse. We've been talking about it for the past 2 weeks, but I'll frame it as a technical question. Is there a technical definition to a collapse in the public health system, and how far are we from a collapse?
We're very near. We're very near. I think pag sinabi nating magko-collapse ang healthcare system, that will be when wala na talaga kaming capacity to accept any patient. And then kasi not just because wala na tayong available beds, but also because nauubusan tayo ng healthcare workers, no?
Yes.
So yun yung collapse na nakikita natin. So I think we need to have an out-of-the-box solution for what we are experiencing now. Kailangan mabawasan ho yung mga pasyente namin na tinitignan doon sa ospital, but kakailanganin ho natin siguro ng isa pang ospital para masagutan yon, ano? So in fact, kay President Duterte, ang Philippine College of Physicians have already written to him, no, na we are already suggesting na baka may mga hotels tayo na pwedeng i-transform into hospitals, and these hospitals will admit yung mga mild na kailangang i-monitor at mga moderate cases, no, na hindi sa mga isolation facility. Para sa ganon, yung ibang moderate cases, hindi na yan pupunta doon sa mga yung sa amin, ano, pwede na nating i-handle yan, and they can already be given whatever medicines and whatever management that these patients need. Pero kakailanganin yan ng healthcare workers pa rin. So, yun kung ina-expect namin dahil sa pwede hong ma-reinforce yung healthcare workers natin coming from the regions natin na hindi naman masyadong burdened with COVID-19 cases, then pwede ho sila yung tumao dito. But we need both lahat ho, the full complement of healthcare workers natin. So may doktor, meron ho nurses, may mga medtechs, no? Kailangan ho natin yan kasi kailangan din nila ng kailangan natin masiguro na yung mga pasyente mabibigyan ng mga medicines at yung mga pasyente magagawa ng mga laboratories na kakailanganin.
Doc, do you need a time out right now? Do you need a time out? And if you do, how long a time out will you be needing? And will you be asking for it soon? Like a 1-week extension, is that enough for you?
We are now on enhanced community quarantine. Remember, nagkaroon kami ng time out, modified ECQ, parang GCQ na pala no, nag-GCQ and ginawang modified ECQ. So, this is actually similar to a timeout except na hindi ho kami ang nagtawag. It is now government na nag-impose nung community quarantine measures nito. And for that, we appreciate it kasi ayaw na namin talagang magtawag ng, di ba, sinabi na namin ito even before, we do not want to call for a timeout anymore. Kasi we know na economically baka magkaroon din tayo ng problema. But yun nga, ang worry lang namin talaga ngayon will be baka mag-collapse ang ating healthcare system because of the many number of patients na hindi natin maaalagaan, and we have already seen patients dying habang naghahanap sila ng ospital na mapupuntahan.
Doctor, sa tingin niyo tama na yung another week of extension? Kasi sinabi ng Malacanang hindi na daw kakayanin na mag-extend na naman ng ECQ. Sa tingin niyo, we will need another week? Kasi parang time out na to.
Yeah, oo. Yung 2 weeks na to, no, I think makikita natin ang bali second week, no, we're on the second week. Makikita pa natin ang result nito after 2-3 weeks. Ako, no?
Yeah.
So, but I think we might need to have another week.
At least one more week.
Yeah.
At least one more week.
Yes, at least one more week. Para medyo kasi malaking bagay yung nare-restrict ang mobility ng mga tao. That's basically the reason kung bakit nagkaroon tayo ng ganito kalaking problema, because people are going out and then they think na pwede na nilang gawin yung mga dating ginagawa nila. Lalo na nung mapalitaan yung meron na tayong bakuna, no? Parang yung idea, narinig nila na may bakuna na, now nag-engage na sila sa mga risky behavior. The risky behavior, yung hindi na sila masyadong nagko-comply doon sa minimum health standards, no? So, yun yung mga malaking factor natin kung bakit we had dramatic increase in cases.
Doc, I'd like to ask you about a statement. Sige po. Lucy, go ahead.
Sige, ma'am. Sundutin ko lang yung sinabi nyo na parang may mga sintomas na parang hindi na nagmamanifest masyado ngayon, or mga sintomas na bigla na lang nagmamanifest. Kasi parang ang daming mga storya ng mga magaling naman sila, mukhang asymptomatic naman sila, or mild, wala pang ang fever, tapos suddenly bigla na lang swollen na yung lungs, hindi na makahinga. Nagbago po ba ang mga sintomas ng variants or whatever it is? No? Nagbago po ba? And what do we watch out for? I guess, kung nagbago man.
Actually, ang parang pagbabago lang na nakikita namin, mas medyo madami kami nakikita ngayon na parang medyo bata at walang comorbidities, walang sakit sa puso, walang diabetes, no? Relatively healthy, and yet ito yung mga nakita naming nagkaroon ng severe or critical na COVID-19. So in a way, yun yung nakita naming pagbabago. Pero yung mabilisan na changes, no, doon sa baga, that is something that we have already seen even before. And that is why hindi nga namin pwedeng basta-basta i-discharge yung mga pasyente, although ang pakiramdam nila okay, no? Kasi yung okay na pakiramdam, yun yung very very subjective lang yun, ano? Pero nakikita namin doon sa x-ray, dapat nahihirapan na silang huminga. Hindi din sila masyadong nahirapang huminga, no? But ito yung tinatawag naming happy hypoxemic. Bagsak yung oxygen, and yet parang ang feeling nila okay pa sila.
Okay,
and that is why hindi nila masyadong nararamdaman yung gravity ng problema nila na meron sila ngayon. So, ito yung bigla na lang nila, bakit biglang nagbago? Kasi hindi naman siya nakakaramdam ng hirap huminga. Pero yun yung problema, happy hypoxemic sila na hindi talaga nila nararamdaman. Pero kami, alam namin, anytime pwedeng mag-deteriorate ang condition nila.
Wow, meron palang ganun, ano? Happy hypoxemic. Anyway, Ed.
Doc,
yes.
Doc, may I ask you about a statement released by Dr. Jose Martin Palo, Director ng Acute and Critical Care Institute ng Medical City. Noong Holy Week, I don't know if you saw it. It came out on Facebook. It even came out as a paid ad on the Inquirer, where it appears that Dr. Palo was calling, at least when I read it several times, it appears that he was calling for a more extreme, I suppose, triage system, where doctors will really have to choose na whether to offer critical care to those who may already die or may not benefit from critical care. In other words, itabi yung mga gamit at yung services for those who are likely to survive. Let me read through to you some portions. In the face of this, it is not right to continue to offer advanced care for all. The value of critical care lies in saving those who would die without advanced care. And we find here that for many of our frailest elderly, it did not make a difference. Therefore, choosing to limit invasive care in favor of comfort care and dignified palliation is a path that can be chosen. Tama ho ba ang reading ko? Parang ganun nga na kung talagang malubha na at mukhang hindi magsusurvive, save the equipment and the personnel for people who are likely to survive?
I personally, no, I cannot agree to that kasi we cannot play gods, no? Hindi yan ang aming trabaho, and that is why yan yung point na ayaw naming mangyari na gagawin namin, no? That we will play gods. We cannot choose kung sino sa mga pasyente ang will most likely die or will most likely survive. Kasi nakakita naman kami ng mga matatanda na nakasurvive, no? At meron ngang bata na hindi naman nakasurvive. So, it is not up to us para mag-determine kung sino sa mga pasyente ang mamamatay o hindi. No? So I think ang importante is that all Filipinos should be given the right quality of care na dapat na tanggapin nila, because that is a basic right of each Filipinos. Hindi ho ako pwedeng sumang-ayon doon sa ganyang klase ng prinsipyo, no? Mahirap pong gawin yan. We are not gods.
Mm-hmm. Although po it is a kind of triage that's practiced in the battlefield, when doctors in the battlefield do have to choose who to save and who not to. Baka po yun ang mindset na niya. I don't know nga if that's why I was bringing it up. If we've gotten to that point, then as you're saying, it is not yet at that point.
Well, as I have said, marami rin kaming naging experience na kahit matatanda, they were able to survive. We have 90 years old, we have 89 years old surviving. So, hindi siguro natin pwedeng gawin yung katulad ng ginagawa natin sa battlefield. Because that one, iba naman yun, kasi kung nakita mo na talaga na wala na, yun siguro pwede mong gawin yan. Pero for COVID-19, this is an acute disease. This is an infectious disease na pwede na reversible, no? So hindi siya yung mga irreversible na sakit na pwede nating sabihin na sino yung most likely will die and will most likely survive. Mahirap po. Hindi, not in this case.
Mm-hmm. Mm-hmm.
Okay.
With Dr. Maricar Limpin, Vice President of Philippine College of Physicians. Doc, maraming salamat po for joining us tonight. Ingat po.
Thank you, Doc.
Salamat, Doc.
We will just go into break, so please stay with us.
We're now in the final stage of our conversation. Now joining us is Philippine Hospitals Association President Dr. Jaime Almora. Good evening, Dr. Almora.
Good evening once again, Ruby. Nice.
Nga pa.
Good evening, sir.
Doctor.
And Doc, you're right. Once again, because kanina nag-usap na po tayo sa big story. That's actually how we started the Chiefs, because I asked you to describe the situation in hospitals now. You said it's a nightmare. Dr. Maricar Limpin echoed what you were saying. And in fact, she said what we need right now is out-of-the-box thinking. On the one hand, how to limit the number of people na dumadagsa sa mga ospital, and at the same time, how to increase the capacity, if not of the hospital, but of the overall health system. What out-of-the-box options might we have at this point na kayang gawin ng all of society?
Okay, yes, I totally agree with her. And in fact, that was what I was saying also a while ago. We have to adopt an out-of-the-box approach here. Now, let us look at this problem as a warfare. It's a war, so there are strategies that has to be employed. And, and in our strategy, we have our front line, our middle line, and have our last line of defense. Our first line of defense, we know our border checkpoints, our street patrols. At first, they are successful, but as we can see now, the people are uncontrollable at they are less effective now in their work. So na-overrun sila at yung middle line natin, yung mga community quarantines, community isolation units, yung temporary treatment monitoring facilities natin, ay puno at hindi na rin conducive para tirhan ng mga tao. So at kinukulang na rin. So we can say na na-overrun na yung middle defense. And sa mga hospital, hindi na rin maka-admit. They continue to work, but they are not already as effective as they should because they cannot attend to all the casualties already. So we can say that our last defense has been overrun, has been overwhelmed. Now it's time to adopt another strategy. Dito na tayo papasok sa guerrilla warfare. But actually, this is what I call war in every door. I call this war in every door because it is now a war in the doorsteps, in our door, in every house, in every office, in every workplace. And the strategy here is for everybody to know their COVID status so that they will not bring home or spread in their houses in their household the virus. So what I have been thinking is for everybody to be able to know their COVID status. They should be able to test themselves. Now, fortunately, we have already the rapid antigen test, which is very reliable. It's specific. But unfortunately, the FDA has not yet released it for commercial distribution. You cannot buy that in the drugstores. So what we are asking is now for the FDA to allow the rapid antigen test to be distributed in our commercial outlets so that people can buy them. And DOH now, instead of what DOH should do instead of putting up all those interventions that they have been mentioning lately, is to teach people how to do self-collection of their nasopharyngeal specimen. It is something very easy. I have been doing it and I've been advocating it. Actually, they start in March 22, as early as March 22, I already wrote the Secretary of Health to consider promoting the use of self-collection because it is the better way to do it. People who have experienced nasal swab, they do not want to be done it the second time because they say it's painful. But actually, it's not. If you are doing it on yourself, it's less irritating because you can actually feel, you can avoid the pain. So when there is a resistance, you encounter obstruction, you can just direct it in a way na hindi ka masasaktan and then direct it to your nasopharynx. It is not painful. It is slightly irritating, but not really objectionable. This should be promoted so that everybody will have a self-knowledge. They are self-informed of their COVID status, and if they find out that they are positive for COVID, they can avoid the transmission. They could find a way, depending on their situation. Iba-iba yung sitwasyon natin, in our living places. Iba-iba, mayroon walang kwarto. So they can make arrangement in a way that they can avoid spreading their diseases. The RT-PCR test has so much time delay. It took so much time to have the result, even with the presence of all the RT-PCR in so many laboratories, yet there is still at least 2 days delay. And that 2 days time, you have close contacts already, and you have spread that to so many places. So if we want to reduce the reproduction time, this is now what we should do. Every person should be able to access the rapid antigen test, because the rapid antigen test is similar to the pregnancy test.
Pero
If-
doktor, sabi nila, hindi ba, hindi siya kasing accurate nung swab or even the saliva. Tama ba yun? Ano yung accuracy niya compared to parehong RT-PCR yun saliva sa kanyang swab. Anong accuracy niya? Kasi sabi nila marami daw false positive, false negative yung antigen.
Well, it is for surveillance purposes. It's not for confirmatory. The confirmatory test would still be the RT-PCR, still the gold standard. But for surveillance purposes, the high sensitivity rate is already enough. And it has been proven already that the rapid antigen test is highly sensitive. It's a chromatography test. If you know the pregnancy test, anybody with this can just buy it in the drugstore and do it on yourself. That's basically what the
DIY. Yeah.
test is.
Pero
It's-
Doc, how many people can really afford to buy that, no? Especially if we're talking about NCR, di ba? I mean, good luck na people will actually set aside money just to test themselves, lalo na those in the depressed areas, no? Na yun ang mga nagka-granular lockdown nga doon dahil doon din kumakalat. So I think isn't free testing something that the government should actually spend on? I mean, it's a great idea. I agree with you, no? But I think the best way to do it is to just give the tests for free, which is what they do in the States, although, of course, they're very rich there, but free ang testing dun eh. So,
Yes,
and so people just go into the clinics to have themselves tested because we don't have to pay anything. Ito, pag kami ang bibili, naku Dok, syempre ang daming hindi bibili. So, ganun din, di ba? Oh,
Yes, but you have now the option. Alam naman natin, ang gobyerno natin, sasabihin natin kaya natin, pero kinakapos palagi. So, marami naman sa ating kababayan na kaya naman nila bumili. We can bring down the price perhaps about 1,000 or less than 1,000 pesos for a test. And pag marami nang bumibili, the law of commerce, marami rin magpo-produce ng
Dok,
test
kasi
kit.
nga, ayuda, 1,000.
Wala pang extension ng ayuda.
Wala pang extension. So,
May extension ng ECQ, wala pang extension ng ayuda.
pera na yun for testing, no? But I like your idea because from the start, parang people were saying nga, diba, why don't you just give free testing, which is what South Korea is doing has been doing from the start.
Yes.
No? You just
Yes,
drive
actually.
in so that you know whether you're positive or not. Because then you can really do what you need to do, knowing that you're carrying the virus. Diba? So
That's the new battlefront.
yeah.
Our new battlefront is in our doors. I call it war in every door.
I
And,
agree with you there. Yeah.
Dok, cambio lang ako. Balik ko dun sa battleground, dun naman sa door ninyo. Kasi kanina we were trying to reconcile the numbers given by DOH, and I suppose you followed the DOH releases every day eh. Kasi iba yung nababalitaan namin on the ground, iba yung numbers ng DOH. Ang sabi ng DOH, for example, today, dun sa NCR hospitals, 79% ang utilization ng ICU beds, 72% ang isolation beds, 60% ang ward beds. Mataas sila pero mayroon pang espasyo. Pero from what we've been hearing from you and from Dr. Limpin kanina, talagang punuan na silang lahat at more than 100%. So how do we reconcile po? Is there a middle ground that we're not seeing here o talagang irreconcilable yung dalawang figures?
Tama yung figure nila. Because they get their data daily. The hospitals submit daily data. But this is the data from all the hospitals who volunteered to admit COVID cases. But you
Opo.
see, ang napupuno yung mga level 3 at some level 2 at saka yung mga identified na COVID center. May mga level 1 hospital who have indicated that their capability also to manage mga mild and moderate, and they have indicated the willingness. Nasama sila sa listahan ng mga available na ICU. Pero in
So
reality,
for example po, yung 21% na mukhang available ICU beds dun sa DOH data today, these are actually hospitals that do not really have very good ICU facilities. Is that what you're saying? Ganun ba?
hindi. Okay. For some reason na hindi namin sinasabi, pero napag-usapan na namin kanina, nag-usap na kami ng PhilHealth. Mayroong konting problema kasi yung nilabas ng PhilHealth na PhilHealth Circular 2020-009, where they limited the healthcare benefit package. Mayroong benefit package for mild, for moderate, for serious, and for severe and critical. Noong una, you remember at the start when the president announced that the government will pay for all the expenses of COVID cases. Diba, sabi. True enough. Initially, mayroon naman talagang binayaran, pero napakalaki, naging mga millions. So immediately, nung na-realize na PhilHealth that padami na ng padami, and actuarial nila hindi na kaya talagang bigyan ng sagutin lahat, nila. Okay, dahil talaga namang dapat limit, dahil hindi naman nila kaya talaga na sagutin lahat. Ang naging problema doon, naglagay sila ng provision that prohibits the hospitals to collect copay. So, maliit na nga yung benefit package, binawalan pa yung mga hospital na mag-collect ng excess or balance, or what we call out-of-pocket or copay. So, yung mga private hospital ngayon, pag mag-admit sila ng COVID case, especially small hospital, pag nag-admit sila ng COVID case, malulugi sila dahil hindi sila mag-collect ng excess. Now, pag nag-collect naman sila ng excess, they are in violation of the PhilHealth Circular, and their performance, that is a violation of performance commitment. You are required to follow all the circulars, and if you violate, you will lose your accreditation. So, it is a choice between malugi, loss, or losing your accreditation. So it's a damn if you do and damn if you don't situation.
Yeah, but Doc, if you don't mind, on the level of, so as you said, damn if you do, damn you don't, on the level of the hospitals. But I just want to ask very quickly, on the level of PhilHealth, are we saying that PhilHealth, I'm trying to be very circumspect here, is calibrating because nauubusan sila ng funds?
And ako naman, dapat lang naman natignan nila. Their decision has to be based on their actuarial. Hindi naman sila pwedeng magdesisyon na bigay ng ganyan kung hindi naman talaga kaya. Hindi naman ibig sabihin na wala silang pundo. Pero they have to estimate kung ano talaga yung magkakasya. So, yun ang ginawa. Ang mali dun sa ginawa ay ipinarehas, nilagay sa one box yung government at saka private hospital. So, sabi doon, bawal mag-collect ng copay in government and private hospital. So, paano mag-collect mo yung private? Okay lang na gawin mo yan. Okay lang na gawin mo yan sa government. Pero hindi mo pwedeng gawin yan sa private dahil pinagagalingan ng income ng private doon sa pasyente mismo. So, yung mga private hospital, kaya may mga ICU na hindi nagagamit. Dahil yung sa mga maliliit na hospital, medyo alanganin sila kung tumanggap sila. Dahil
Doc, kasi our context, Doc, our context here, Doc, is that we were talking about yung hospital occupancy. That was our context. So tell me if I'm getting this right. You're saying po that some of the smaller hospitals are not accepting patients anymore because they cannot afford to take in COVID patients even though they still have the bed spaces? Ganun ba?
Okay.
Is that what it is?
Nag-a-admit sila. Pero ang natural tendency kasi is to expand. Diba? To expand. But alanganin silang mag-expand. Now, hindi lang yung tungkol sa PhilHealth ang dahilan. Of course, ang hindi nila pag-expand na ngayon ay yung kulang na rin ang manpower. So, it becomes a complex problem. And tungkol naman dyan sa PhilHealth, nag-meeting na kami ng PhilHealth kanina at napag-agreean namin na titignan ni PCO Dan Tigiran at sabi naman niya, I will do something. I will see to it na hindi maging hindrance. Kasi naging hindrance ngayon pero aayusin. At naniniwala naman kami na aayusin ni PCO Dantigiran yan.
So you're saying na yung shortage ng hospitals ay primarily na-experience sa tertiary level, yung mga ganon, sir? Sila yung mga punong-puno?
Yung mga identified na COVID centers, doon ang kasi COVID center doon ang referral. So for example, nagpunta yung isang COVID positive sa isang level 1 hospital. Sasabihin niya, hindi kami identified COVID center, doon ka na lang sa identified COVID center. In reality, mild lang yung case, pwede naman sana niyang i-admit. Pero yun nga, nasa dilema. Kung admit niya, malulugi siya. Kung para hindi siya malugi, sisingilin niya yung balance, magbayad.
Full pay.
Malalaking hospital, they are in a better position kasi hindi naman talaga kayang isara yung mga malalaking hospital kahit na magsingil sila.
So sa tingin nyo, Doctor, sabi ninyo, yung solusyon nyo is testing. Apart from testing, yung gobyerno ngayon, inapprove na daw yung magbukas na naman ng mga hotel isolation centers. Merong mga local government na nagra-rush ng mga shipping containers na nire-retrofit to become isolation centers na naman. Tapos Red Cross is working with several schools to develop more quarantine facilities. Sa tingin nyo, it will work dahil sinasabi nyo kulang naman yung tao.
Pwede, yung gusto nilang gawin, pwede naman. Pero if you look at the doability, yung gusto nila at saka yung pinopropose ko, sa tingin ko, yung self-knowledge kung ano yung sitwasyon mo para hindi mo ikalat yung sakit, yun ang importante. And then giving you the responsibility to prevent others from getting the virus from you. Yun ang nakikita ko na battlefront. Yun yung battlefront natin ngayon. Of course, wala namang masama dun sa gusto nila, pero alam mo naman yung logistics needed. Itong logistics, i-spread mo ito eh. Pag if you just allow people to buy, mai-spread kasi yung responsibility. So it's not something na beyond capability anymore. Makakapag-remedyo somehow yan. Pero yung gagawa ka ng mga facilities, malaking pera yan.
Pero how available na ba yung mga rapid antigen test? Kasi alam ko may nagbebenta niyan sa online. Halimbawa, pumunta kami sa drugstore, makakabili ba kami niyan? Mabilis lang?
Hindi pa approved.
Hindi pa nga raw commercially available.
Kaya nga Pero sa online actually, you can get May mga kilala akong gumagamit na niyan eh.
Yes.
Merong nagbebenta, pero parang tago.
Maraming gumagamit. But FDA has not approved yet. Kasi they are dragging, hindi ko maintindihan din kasi everybody's using it but they have not yet approved it.
Doc, I'm sorry. I'd like to go back to the concept of yung bed utilization with the ICUs and the isolation beds and the ward beds. Just to recap, Doc, you're saying kasi nagkakadilema yung ilang private hospitals kasi although meron pa silang available beds, whether ICU or isolation beds, they have a dilemma because malulugi sila with the new PhilHealth circular. So para hindi sila malugi, they end up referring the patients to other hospitals that won't have the same problem. So in effect, they're turning people away. Ganun ho ba? They're turning people away because they have financial problems.
It's not hindi ganyan kasimple. The problem has become a complex problem, Ed. You should view it from all angles. Isa lang yan sa mga reasons.
Opo, it's one of them.
The bigger reason is the lack of manpower. So when we say hindi na namin kaya, puno na kami, it may not be necessarily referring to the capacity, but the capability. So yung capacity, nandyan yung ICU mo, nandyan yung ventilator mo, pero wala ka naman ng nurse to man those things. So hindi mo maibigay yung, hindi ka na capable to buy the services. So it's not the capacity, but the capability. And ayun.
So the numbers actually, the numbers are not accurate. That's what you're saying. The numbers are misleading.
No, because they are talking of capacity. Totoo yan, may capacity sila, but they do not have the capability. Wala yan sa data. Wala yan sa report yung capability. So yan ang na information.
Yes.
Dapat nang tignan yung manpower.
Kasi
Wala namang
number of beds lang.
Okay, yeah. So
Oo.
when we talk about capacity, the official reporting is rather simplistic.
Yes, it's simplistic. It should be capacity and capability. If your capability is yung manpower mo, yung resources mo, that's your capability. Yung capacity mo kasi is how much can you absorb. Okay, ikarga mo diyan, kaya ng truck ikarga, pero meron ka bang kargador na magbubuhat niyan? Something like that. Okay. So yun ang capability.
Okay.
Alright.
Overtime na wala. Sige, habol mo sana ako sa tanong eh. Okay. Okay, maraming salamat Dr. Jaime Almora ng Philippine Hospitals Association. Sir, maraming salamat for joining us tonight. Datingan po.
Thank you, Doc Ramon.
Salamat po, Doc.
Yeah, welcome Lucy, Ami, and Ruby. Welcome.
Okay. And that'll be all for this Monday edition of the Chiefs. We hope to discuss it. We'll keep the conversation going. So remember, mask on, wash hands, and stay safe, Philippines. I'm Edwin Gao.
I'm Ami Paminton of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.